Vivian, I want to say thank you for stopping by. You came by with your husband John today, and it's great to have you by the clinic.
Thank you, David. It's exciting to be here at your place again.
Well, good. Yeah, it's been a few years since you've been here.
Yes, sir.
And I know you had quite the clinic down South Florida. Tell us a little bit about that.
Well, I can tell you this much. I wish you had been there to help me set it up. This place is absolutely phenomenal. It's definitely the nicest place I've ever been into in a massage clinic.
Well, thank you, Vivian. What intrigued you? Because I know you had a very large clinic. You've employed a lot of therapists.
Well, there were several things that I was impressed with when I first walked in. The professionalism of it, the cleanliness of it, the professionalism and the friendliness of your staff, especially Sonia. That was, and also one thing that I caught that you did, that I see a lot of people not doing in all sorts of businesses, when somebody left, you acknowledged that they were here and thanked them for being here.
Right,
That's
yeah.
so important.
Yeah, no one gets out of our office without almost everyone saying goodbye.
I admire the fact that you have all of the charts and everything so you can walk people through what their problems are and help them out and make them understand. I think that's really important and something that we never did in the office. I never had that opportunity.
We didn't have the tools, I think. You know, when you and I first started out, there were tools out there, but they weren't really therapist-friendly tools. I think that that's what actually led you to design this. Was not having the tools, and this is actually the Bible that I use here in the office for insurance billing, is Vivian's book. So on insurance, Vivian, tell us a little bit about it.
Well, I guess you could say it started because I was the first one to do insurance billing, and everybody started asking how I was successful getting paid by insurance companies, and then the Florida State Massage Association asked me to serve as insurance committee chair. Prior to them asking me, I'd already written a book. And it was like a little 83-page book.
I remember it because I owned it.
And so the FSMTA worked with me, and we sold it through the FSMTA as long as I was insurance committee chair. And we changed the book over the years, and now we have this. It's 465 pages of stuff to keep people informed of how to bill insurance and how to start a practice and how to work with the IRS and taxes and independent contractor versus employees. Everything's in the book.
Well, that's great. And like I said, it's a book that I use. I contact Vivian for guidance, and we compare notes up and back on different things going on in the insurance world. Vivian and I used to attend some insurance conferences together. She goes to all of them, but in the early years when we were just trying to figure out, remember we met at the Workman's Comp Conference.
That's right.
Orlando, and Robin was working with me at the time, and we were all going to different classes, and we compared notes on break.
That's right. There was probably 20 or 30 classes. We're trying to get them all in, and everybody's going in different directions. And then and this coming year will be my 25th year to attend that conference.
Well, congratulations.
Hope you'll join me this year.
I'll try. I'll try. Vivian, also with insurance, and we were talking about the clinic and using a posture chart. Could that help therapists doing insurance billing if they are taking postural photos and documenting that?
By all means. First of all, it's the communication with the patient to let them know that you know what you're talking about. It gives them the confidence in you. It keeps them coming back because they have the confidence in you. It helps the physician to have confidence in you because you're changing the patient's condition, and that helps the physician to understand that you know what you're doing.
Because you can measure it. You can show them the pictures.
Right, you can show them the pictures, and they understand pictures better than anything else. And helps you to be able to document better, and when you document better, the insurance companies understand better, and they will delay, deny, and reduce your claims a whole lot less when they know you know what you're doing. Right.
So postural photos, trigger point images attached sometimes to notes or to physicians could be useful for a therapist.
That's absolutely right.
And I know you and I both believe in big-time patient education.
That's right.
So the charts are a good way of utilizing that as well.
I just want to say those charts are the most phenomenal charts I have ever seen. And I sure wish I had had them in my office, because I would have used them to show the patients what we were doing with them. I just can't tell you how impressed I am with your office and with you, David.
Well, thank you very much, Vivian. I think we're mutual admirers of each other. We've known each other for a long time. I know you've made some major milestones in the massage therapy profession. So I really admire that you've done that. I know your commitment to sitting on committees, and you serve on a state level, on a national level. You're a resource, and it's really made a difference in the profession. So I want to just publicly thank you and let the profession know that insurance has really gotten to where it's at because of a lot of the efforts of what Vivian has done.
And I think the most important thing to do, whether they're on there or not, the most important thing is if people understand how they can make people better. If you go in there and you're working on somebody and you're not showing progress and improvement, the insurance companies will not pay. Mm-hmm. It's important for us to show that we know what we're doing, we understand what we're doing, and that the patient improves from what we're doing. And if you don't do that, and the insurance companies start seeing that we're doing things haphazardly, the notes are not professional, then they stop paying, or they start raising red flags, and insurance companies deal with other insurance companies, and pretty soon the word gets out that we're a bunch of nitwits. And
so then utilizing forms to document, like pain scales when people come in, right. Having them color in their areas of pain, because then over a series of treatments you might see that they're not coloring in as big of an area.
Right.
Having them track their pain patterns. It's important that you're watching for 3 things, I would say. I tell all my patients, it's frequency, intensity, and duration are the 3 things that I'm always looking at. So are the headaches, are they less often? Are they less frequent? Are the headaches less intense when they come? Or are the headaches less frequent, less intensity, or the duration of them? How long do they last when we get a headache is very important.
Right. And the effects of it.
The effects of it, and how does posture work with that? You know, when there's a posture problem, are you looking at the posture? Are you documenting? Are you showing that there are changes, range of motion, how the posture could be stressing the muscles and causing trigger points?
I just want to say I had a headache when I walked in this place, and just being here, it's almost gone. I'm serious.
I haven't even worked on her yet, and she's feeling better already.
I'm really serious.
Well, again, I want to thank everyone for coming. Vivian, thank you for coming by. I want to invite you back.
I just want to share something. Okay. You can keep this on there or not. It doesn't matter. But one time you invited me to come up to Orlando. You were going to do a seminar for case managers, and I hadn't met you. I had never seen you do a seminar before, and I'm so into the insurance.
Oh, I remember. That's when I did the whole case manager group in Orlando, right?
And I was so into insurance and trying to make sure everybody did things right and make sure that we didn't raise red flags with insurance companies and everything. And I thought, oh my God, I hope he doesn't screw this up. I'm not kidding you. And I got into that class. You set me off on such a high. It was the best class I'd ever been to. It was so exciting. I can't believe that every one of those case managers didn't want to either be a massage therapist or come in there and tell us that we could bill insurance through them.
And that was big, because we had people from Disney, we had all over. It was in the Orlando area, and I spoke to at a case manager's luncheon that day.
That was the most dynamic seminar I'd ever seen.
Well, thank you for coming and being supportive, and I'm glad I didn't put my foot in my mouth that day with you.
It was great.
So again, I want to say thank you to everyone for joining, taking a few minutes to be with us. I want to thank Vivian and her husband John for stopping by. And stay tuned, stop back and see us, and we hope you've enjoyed the process.
Thank you so much, David.
Bye-bye.